No, everybody's got a cell phone. You would not take your cell phone and repeatedly throw it against the wall or on the ground and then expect it to work. Yet that's exactly what we're doing to brains of hockey players. And these brains are very delicate instruments, and they're not designed to be banged up like they are.
All right, welcome back to our special on concussions on CTV Morning Live. We are live at the Superdome this morning in Ben Franklin Park, and we are joined now by a team of experts who are going to answer questions that we have taken from you, our viewers, and we thank you for those questions. I want to introduce our panel first off. To my immediate right, as we introduced earlier this morning, Dr. Roger Zemek, an ER doctor at CHEO. Thanks for joining us once again. Mona Allan, who's also as well been on earlier this morning, a nurse with ThinkFirst. Thank you so much, Mona, for being with us. A new addition to our show this morning, Dr. Blaine Hoshizaki. He is an academic scientist at U of O. We'll be speaking with you again later on in the show. Dr. Hoshizaki, thanks for being here. And Todd Jackson, again, from Hockey Canada. Thanks, folks, for joining us here. We're going to get right to these questions. And the first one comes in from Beth on Twitter. Beth wrote to us, how important is it to get kids to explain their symptoms? And Mona, I want to ask you this question.
So I think explaining the symptoms is key. It really is the hallmark. It is the be-all, end-all on making anything else grow from there. So with the assessment, then we can manage the children, you know, whether it's at their physician or the ER, to get them back into play safely and in following the guidelines that have been established. So it's key.
It is key. On Facebook, Sam asks, and this question perhaps for you, Dr. Zemek, if my child gets a concussion, is it okay to go to our family doctor, or should we go to the ER?
That's a great question. For most patients, having a concussion, they need to be evaluated at some point by a physician, especially if they are involved in sports. A physician will need to return them to clearance to eventually play and to participate in a game. However, there are sometimes some concerning symptoms that do require an emergency visit, such as a worsening headache or new headache, vomiting persistently, becoming more drowsy, unable to wake them up, having a seizure. Those are potential emergencies for two things. One, it may be more of a severe injury than just a concussion and requires an evaluation by an emergency.
Interesting. Always better to err on the side of the caution, and no matter what, go to your doctor?
Yes.
Okay. This one coming in from Shirley via email, and this one perhaps for both of you, Mona and Dr. Zemek. What are the key words that kids will use to describe their symptoms that would indicate that there has been a really serious injury, maybe a concussion? Something they might say, Mom, I have a headache, Mom, I feel this. What are some of those words parents really need to listen for?
So on the sidelines, you will typically hear that bell rung thing. I don't know if it's just because their parents are out there using this word or whatever, but it is really one of the big ones that I will hear. And then the next thing is I have a headache or dizziness. Those are probably the biggest things that they will say on the sideline.
What are you hearing in the ER, Dr. Zemek?
I think one of the things to add is sometimes parents know when their child's not right. So sometimes a child may not be recognizing that they're not the same, but the parents may recognize that their child's more sleepy, a bit more confused, a bit slower to answer questions. And those are things that parents can do to then further ask their child if they're experiencing additional symptoms.
That's a great point. Really paying particular attention to your child's behavior. This question came in from Sunny. It is on Twitter for Dr. Hoshizaki. The Canadian Medical Association recently called on the NHL to do more to take violence out of hockey. What are your thoughts on violence in hockey, and should it be removed altogether from the sport?
Well, I think there's two kinds of violence. One is violence that's accidental, because the game is intense, and we want to maintain the physicality of the game and the intensity of the game. The violence that we're talking about is a violence that contributes to the high risk of concussions and brain injury in general. And I think that violence has to be addressed, and not only by games like hockey, but all the different games that have created this risk for concussion by the way they play the game. And there's absolutely no reason that we cannot manage that risk. There's always going to be accidental injuries, but that'll be a part of the game, and that's where that should remain.
I want to follow up on that question with helmets and the equipment that players are wearing. Now, let's focus on hockey, because I know in your case, that's a lot of the research you've done. How much does equipment have an effect on how a player will play? Does it, if they're well equipped, do they play differently? Like compared to, we'll say, decades ago when helmets were not worn in the sport?
Yeah, I think what we forget a lot is that there's a lot of children that play the game, and every time a newcomer comes to the game, especially 12, 13, 14 years old, it's not reasonable for them to make a decision about the risks that they're going to face. So when we dress them up in very sophisticated equipment we have today, they feel safe. And And of course, that's really not the reality. The reality about helmets is that they were designed to protect against catastrophic injury, not concussive injury. And with that in mind, the truth of the matter is that helmets do not do a really great job. Helmets today do not do a really great job of protecting against concussion.
This question for Todd from Hockey Canada. As a parent, this comes in from Lawrence on Facebook. As a parent, how can I be sure my kid's safety comes before winning the game?
You know what, I think that it's a great question, and I think what it portrays is the fact that parents need to be involved with their child's experience. And I think what we're trying to get through to parents now is we have to create an overall respectful environment, and you have as much a role to sit down with your son or daughter and say, this is what we expect when you play the game, and we expect you to play a respectful game, and we expect you to go out there and not hurt other players and enjoy it. I think parents enjoying the game as well is key. Let them know that they're enjoying the game as it's being played by the rules and without the violence, if you will.
Very good. Karen writes to us on Facebook, and this question, I'll ask anyone who'd like to answer, but I'd like to start with Dr. Zemek for this one. I'm a soccer coach. How do I ask my athletes about their symptoms without leading them? So they've had a hit and they're on the ground, I suppose, or maybe they walk off themselves. You don't want to tell them what they're feeling. How do you ask those questions and make sure you're getting that information out there without leading them into answers?
Well, there's some great tools that exist for both clinicians and trainers and people who may be parents who are participating on the sideline. There's a tool called the SCAT-3, and there's now a child version. And it's straight up, most of the questions are yes, no. And so it's okay to ask them these questions. Our education needs to be for the children to be honest, and that's where the roles of the parents can be. If your child's participating in these, it's important for parents to educate their kids why it's important to be honest about their answers.
I want to get your take on this as well, Mona, because you're a trainer and you have teenage kids who play sports. I want to ask you what you would suggest here.
Yeah, so I am a trainer. I've been doing it for 10 years, and I think what you can really draw out of that also is the importance to observe the children. So you know the kids, especially if you've been with the same group of kids, which happens often in rep or the higher levels of play. You're with a certain group and you really do get to know their disposition. You know, you'll get to see those things that you can observe, the way they walk off the field, the way they're acting on the sidelines. I've seen it often where the kid is the quietest kid on the team, comes off, throws his hockey stick or whatever. So that's a sign to me. So watching and looking also will help you make those decisions on the sideline, and don't ever dismiss how you feel and what you think as a coach or trainer.
Okay, this question coming to us via email from Peter. Peter writes, my 13-year-old son had a concussion while playing hockey. He sat out for one period. How long should he sit out of the game when this happened? So that's what happened when he sustained a concussion. If this happens again, Dr. Zemek, how long should someone sit out if they've suffered a concussion?
Well, the first and most clear rule to make for our audience is when in doubt, sit them out.
Okay.
So if they had a concussion that game, they are not to play at all that same game.
Good point. For
And
any game, are we talking any sports game?
Any sports game. And despite the horrible thing that happened to some famous athletes like Sidney Crosby, it's a lesson to learn that if someone this important to their team is missing key sporting events such as a Stanley Cup final, your child can miss this game. And I think it's important to recognize that there's a stepwise progression to when they can go back. So there's not a clear answer. And the minimum that they're going to be to, assuming all their symptoms are resolved, it may be almost a week by the time they're back, but some children maybe weeks or months.
Months even.
And that's where good involvement with their doctor is important.
Many of you are parents, I know that for a fact. Dr. Hoshizaki, you have teenagers who play sports, and you're very encouraging of sports. How do you make these decisions, or how do you look at sports knowing that everything you do, your expertise in this field, when it comes to watching your daughter play rugby, for example, does it change your thinking? Do you, as a parent, look at it differently because you're above the average person for knowledge in this topic?
Well, I think we have the advantage of most of us here on this panel of being involved and certainly have played the game. And I think one of the things that the parents can do is to ensure their children a couple of things. One, that they get involved in sport early, because they develop the skill sets that are necessary to help them protect themselves.
Okay.
And secondly, to become knowledgeable and involved. As Todd has said, being involved with your children is no different than academics. The more you're involved with your child, the safer and more successful your child will be. And the third piece is to make sure that the child is educated, that they understand the challenges around injury. And for us, for myself, of course, brain injury is one of the concerns we've always had. And but you always weigh off the advantage of being involved in such great sports like hockey, football, lacrosse, and rugby against the risk. And you have to make sure that you prepare the child to manage the risk, but also have them involved in sports that really enrich their lives. And it's a great question, because I think most people here would say that we're here to try and make sure that our children and their children have a great experience in sport and do not take on unnecessary risk.
I think that's really well put. Doug, we'll leave it right there on that note. I want to thank all of our guests on our panel this morning. Dr. Zemek from CHEO, thanks so much. Mona Allan from ThinkFirst. Dr. Blaine Hoshizaki is going to stick around. We're going to talk to him a little bit more about the equipment side of things coming up a little bit later on in the show. And Todd Jackson from Hockey Canada, thank you so much. Again, like you said, it's certainly about informing, raising awareness. I think we're doing that today. Thanks to all of you for being here.